Welcome and thank you for joining us. This is part two of our diagnosis series. Last time we talked about the 10 questions, and I'll have that video up on the blog soon. But tonight we're going to tackle one of the great mysteries of Chinese medicine diagnosis, the tongue. Probably the strangest looks I get in the office are when I politely ask people, may I see your tongue? And the results are anywhere from a cheeky stick out of the said tongue to eyebrows raised, tentative glimpse of just the tip between tightly closed lips. So clearly, we've all been taught that this is not appropriate for polite company and respond accordingly. But luckily for me, my clinic and medicine in general is not about polite company. We're here to answer questions about your health, which brings me to why? The best impudent question of all time. Why do we care? And, mostly the tongue is giving us a fair picture of the nature or quality of the patient's qi and blood. It also gives us a glimpse into the condition of the organ systems of the body. And it's an excellent way to confirm or deny what's already been gathered in our intake interview, like we talked about in our 10 questions last time, or when we're doing our pulse taking. So it kind of like it's going to confirm what we already know, or it's going to throw a completely different light onto that subject and give us new information that we can use to integrate. So, tongue diagnosis is just, it's imperative that we have a tongue diagnosis for herbal prescriptions because in addition to telling us a little bit about your syndrome and your differential diagnosis, it also very clearly states or very clearly shows us the state of a person's digestive function. And as most herbal formulas are taken orally, this is really important for us to consider as herbalists. So the last thing that I love about tongues is that they're not liars. I don't mean to like offend anybody, and I'm not to say that patients and pulses are, intentionally attempting to hide things, but they're perhaps just a little less reliable than what the tongue has to say, and because they can be influenced, right? So by either, our own impressions of ourselves or by, our response to the physician. So we love to use the tongue in diagnosis because the tongue results are empirical. When you're taking an interview, sometimes people are shy about answering questions honestly. And when you're taking a pulse, sometimes, well, I know people can control their pulses, whether they mean to or not. But also the simple act of a physician taking a pulse. We're instructed when we're in school to not take too long taking a pulse because your chi can affect your patient's chi. So, once I've laid my hands on your pulses, by observing them, I am changing them. So, I think the tongue is great because it just exists in your body and it is what it is at the state where it is. It's like a little snapshot of a picture of your body in time. And there's really nothing you can do to hide it or change it, or, it is just going to be what it is. So, yeah, the tongue is a really useful tool because of that. So, you want me to know, because this is the other thing people always ask, why? Why do you look at my tongue? Like, what are you looking at? Like, is there something, terrible to see there? And, for us, when we're looking at your tongue, we're looking at four main things. So, the first of all was the color, the shape, the coating, and the moisture. So, the color follows a spectrum from an almost blue to like a deepest red, and each of the colors on that spectrum tell us different things. And this kind of helps us to identify the levels of deficiency and stagnation, and also the temperature dynamic of your condition. So, like whether or not there's the presence of heat or cold. The shape is all about excess and deficiency, right? Is it long? Is it short? Is it skinny? Is it swollen, scalloped, rigid? All of these words are informative to us. And the coding is all about organ function, right? Most specifically, the stomach and the state of digestive function, but it also helps differentiate between excess and deficiency, cold and heat. And while I know that many people find that a tongue coating is something to be scrubbed, and I won't disabuse you of this notion, as an acupuncturist, I beg you, do not scrape your tongue on the day of your appointment because the scraping of the tongue coat will destroy just this vital diagnostic data for us. So oftentimes I can tell if a patient scrubs their tongue or scrapes their tongue. And if I can't, then I'm sort of, I'm being misled a little bit. So we really want to see that tongue coat in all of its glory. Right. And then the moisture content is specifically a measure of your body's fluid metabolism. And it's important, particularly in cases where there is a multi-layered diagnosis that requires like a balanced treatment. So, for instance, when you're clearing damp in a person who is also yin deficient, right? Yin deficiency is an absence of moisture, and yet we have damp, which is an accumulation of moisture. And so, when you're balancing those two pieces, you can really pay attention to the moisture on the tongue, and it's an indicator not only of the progress, but of sort of, what level and strength of treatment the body is ready to withstand. So I love this picture um, because it's perfect. It's got all of the colors of tongue diagnosis in it. And so you see, I've added little circles in here. And so we see the pale red. The ideal that we're looking for is pale red, and you'll see that at the bottom, right? The official description is like fresh meat underneath a thin white coating, right? So if you take a fresh meat and and then layer over it sort of a translucent white coating, if you can kind of think about that. That's what you're looking for. And so it ends up looking like a pale red, right? And it's like that one at the bottom. Anything that deviates from that is an indication of imbalance. So a dusky would indicate stagnation. Red, like that red right there in the center, that is indicating heat. Pale over here on the right-hand side, that's deficiency. Purple is blood stagnation or cold, and blue is cold, leading to blood stagnation. So purple and blue are always like stasis, right? So, oh, look at all my beautiful animation. Haha, see, I had it all there and I didn't even know it. I guess I have to go back to my slides. Anyway, so the tongue coating, you want to think of the tongue coating as sort of like texture. It took me so long to find pictures that were not like super graphic. We all very used to graphic tongue pictures in Chinese medicine school. I've seen thousands of tongue pictures. And it's always a little funny. I don't mind looking at them because I look at them all day long. And for me, it's really just it's another piece of the puzzle. But when other people look at them, they see someone's tongue hanging out. And so they attach that tongue with a person, and that then has social connotation to it. So I'm I'm very detached from it, but I'm trying to respect the fact that this is going in front of other people. So I tried respectfully to choose images that could explain to you what I'm trying to describe without, making you look at everyone's tongue hanging out of their mouth because you're not an acupuncturist. You want to look at your own tongue, but you don't need to diagnose everybody else's. So but think of the tongue coating like texture, right? That rough top layer that shifts and changes depending on what you eat, right? And this should be thin and white, right? Which means that like white as in the color, like as opposed to gray or yellow, right? Which we can see in the tongue color and thin, right? Which means that we can see the tongue color underneath it. So this is the goal. And there are variations on this, and everyone is constitutionally disposed to variations. But if you see the left picture, right, this tongue is a little pale, but the coating is thin and white, like it's not colored. And you can see the color of the tongue underneath it, right, which is why I say it's a little bit pale, right, because if it were a truly normal, like, pale red with a thin white coat, like if it was that, then you would see it would be a little deeper red that you could see through that tongue coat. Right. And there's also there's some little red dots you can see at the bottom on that picture as well. And those could indicate damp or heat depending on their location. We call them prickles. And we see it a lot in children actually because their tongues kind of get all over the place, right? A thicker tongue coat, or one which obscures the color of the tongue underneath, is an accumulation of external damp. And you can see that in the top right. So this is a thicker top coat, right? And you can't actually see the color of the tongue through that coat. So that's a thicker coat or a thick coat. And in this picture, you can also see that it's a yellow color. And so we would interpret that as damp heat, right? Now, thinness or absence of coating, right, happens when the tongue looks shiny. and I didn't find a picture of this, but I think it's pretty clear. Like, you either have that matte look that shows that there is a coat, or the tongue is shiny and there are pieces that don't have coat. And sometimes, like, only pieces of the tongue don't have a coat, and that is also diagnostic. So, a thinness or absence of the coat, though, is an indicator of yin deficiency, as are cracks, as you'll see in the bottom right picture, right? There's a little crack down here on the bottom. So, a rootless coating is often what a coat will look like after being scraped. And you can see just a little bit of that if you look in the center of that bottom right-hand picture, just to the left of the crack, right? And this is a rootless coating, and it points to poor quality stomach chi, right? So when we see that, we go, oh, okay, so clearly your stomach is not able to like produce a substantial enough coat that like it's made a coat, but it's not keeping the coat, right? And then a greasy or a dirty coat, which again, like I had said earlier, that damp heat coat in the upper right hand illustration, right? So a dirty coat, this one is actually a little bit greasy, and so, yes, a thick yellow coat is damp heat, but if you look at a coat, and specifically this coat, it's also a little bit greasy, and so we say that's actually more like phlegm, right? So this might be more the kind of coat you would see with somebody who's got like, I mean, I would see this as like a smoker's cough. You could see this kind of tongue on somebody, or you see it on somebody who's still, I see it a lot when I'm treating residual coughs, like people who've had, like a pneumonia that's just finally clearing their body. You'll sometimes see that yellow, greasy coat, which is just an excess of phlegm. And I also want to point out that a little spot of moisture on the bottom of the left-hand image there, like down that bottom, there's a little like spit bubble, right? So that's also, we're looking for moisture, right? So the image in the top right is the driest of all of these, and it really is, and you can see like that surface moisture on the picture on the left. And so we do look at those, and it's really, this is for us all about what your body is doing with its water. Do you have enough? Is it distributing it properly, right? And so pre-appointment don'ts. I know these are the inside tips that you're really looking for here. Like, what do I do or not do before I go see my acupuncturist? So, the tongue coat is affected by what you consume. So you have to remember that, right? So if you had blueberries or turmeric, right, or coffee, right, the impression of your tongue is likely to be skewed. So those things will stain the coat of your tongue. And it's not that we can't use it for diagnosis. It's just that we need to know what you've eaten. So we know, you know, is your tongue really blue? No, your tongue's not really blue. That's blueberries. And oftentimes we can tell that it's food-based, but it's a good thing to keep in mind, right? And then the pro tip here is that, well, I know that a lot of you find that, scrubbing your tongue, right, and scraping it is really important for your dental and your oral health. I'm not going to try to disabuse you of that notion. But as an acupuncturist, I'm begging you, don't scrape your tongue on the day of your appointment. So, first of all, because like we can usually tell, but second of all, like when you scrape that tongue coat away, it just destroys this wonderful diagnostic data that we could use to help like further enhance the picture of your differential diagnosis. So no tongue scraping on the day. Do it every other day if you want to. I'm not going to deny it. It's not bad for your health. I don't know that it's necessary, but not when you come see me. All right. So now, the other thing we look at are the tongue areas. So tongue topography really allows us to analyze sort of any particular features or asymmetry on the tongue. So for instance, one of the most common features I see on tongues, particularly in children, is a red tip, which is to mean like it's speaking of heart, heat, or fire, which manifests itself as agitation or restlessness and insomnia in an excess picture, or palpitations, insomnia, anxiety, and poor memory in deficiency cases. So maybe you're familiar with that. I see a lot of adults with a red tip too, but both excess or deficient heat are common in children because they do have a tendency toward that yin deficiency. They just can't keep up with their growing bodies. And they also both, and they require a lot of activity, or like so that powerful yang energy of their body is just built up into heat. So, this is a common thing. But of course, you see it on the image here. Each of the different areas of your tongue correspond to different organ systems. So that red in just the tip, we know that's heart, right? Sometimes also we'll look at coding changes. So like sometimes I'll see that only the sides of the tongue are peeled or shiny, whereas the rest of the tongue has a really even coat, right? That would indicate that we're looking at something that's more like a liver yin deficiency as opposed to a heart yin deficiency or a kidney yin deficiency. And so those are different ways that we can use the coding for differential diagnosis, but also we look at shape changes um, as well. And so, if I see scallops in one area of the tongue, scallops are an indication to me of qi deficiency. And so, you tend to see them on the sides and sometimes the tips. So sometimes it's just an all over overall qi deficiency, right? But sometimes it's also, location specific. And so we'll use the shape as well. Or sometimes there's bumps, like one side of your tongue will be higher, or you'll have like a little bump in one area, or oftentimes like there'll be different signs in the back of the tongue than the front of the tongue. So all of that is differential diagnosis. And then of course you know there's these little areas in the sides of the tongue, and if you see purple in those areas, that's really indicating that there's something going on in the chest, which for our purposes is the lung, the heart, and the breasts in women. So those are different areas on your tongue to take a look at. In terms of advice for the layperson, right? First of all, tongue diagnosis isn't unique to Chinese medicine. So they also use it in Ayurvedic medicine as well as using similar observations, right? So and those all play a role in how like an Ayurvedic physician or would diagnose your dosha type. So tongue diagnosis isn't unique to what I do as a Chinese medicine practitioner or as an acupuncturist. It's a really common tool that's been used in traditional medicine for a long time. But many of my patients will tell me that, like, now that they know that their tongues say something about their health, they just can't stop looking. So I thought I'd include this just at the end here to give you an idea of what you can do for a layperson. As I said yesterday, my kids, they find the idea of being able to diagnose someone based on their tongue to be infinitely entertaining. And indeed, there are loads of information that's just sort of hanging out there on your tongue, but it's really only one of the tools we use to make our diagnosis in Chinese medicine. We certainly don't make whole diagnoses off of the tongue, but I would say first and foremost for you, the layperson, to start paying attention to the color of your tongue. Right? So if your tongue is pale, and it might not be pale all the time, but if it's pale today or at the moment, like maybe think about giving yourself a nourishing meal or a nap, right? Because this would indicate that there's either a qi or a blood deficiency. And using, a nap to either rest your body and give yourself a chance to nourish the blood, or eat something that's hearty and nourishing to your body so that your body can make more qi and blood. Those two things could be really helpful. So you wake up in the morning, you're like, oh, my tongue's so pale. See if you can't schedule some time in your day to have a rest. That could be helpful. And or just make sure that you've got a plan for how you're feeding yourself that day. If it's dusky, this would indicate qi stagnation or blood stasis. Either way, those two things can be helped by going for a walk, right? We look at qi stagnation in Chinese medicine as one of the signs of stress. And so movement is really, really helpful to many of us when we're dealing with stress. So go for a walk, take a sanity break, and then if you find that your tongue coat is sort of consistently or habitually thick, I would think about looking at your diet and seeing if you can't find places to make changes or getting a good herbal prescription. So because that sort of consistently thick, it's an indication that there is an accumulation there that could easily be cleared either with a little boost to your metabolism through your dietary changes or through an herbal prescription that you can get from an herbalist. So always, when you're in doubt, find a good acupuncturist to help you. Other people are always more objective, and having a professional opinion can make all the difference. But I thought that would just give you a few tips and tricks for, this is what your tongue says to me. This is what your tongue can say to you, and don't be alarmed the next time your acupuncturist asks you to show them your tongue, because it really is diagnostic. If you like learning about TCM and you enjoy these talks, please go to the website and sign up for our newsletter. I only send out the newsletter once a week, and my goal with that is to keep it short and sweet. And I want to make sure it feels really uplifting to you because our inboxes are all too busy. I do this every 2 weeks, and starting not next week, but the week after, we're moving them to Monday evenings at the same time. So there's going to be a little bit of a schedule change, but I'm going to keep going every 2 weeks. And I've got a bunch of topics that I'd love to share with you, but I bet you have a bunch more that you're super curious about. So share your ideas in the chat or in the comments. And remember that I also have free 20-minute consultations where you can ask me anything, and I'm happy to listen and help you figure out if TCM is the right tool for you and your health condition. So thank you all for coming, and we'll see you next time. No, I didn't specifically go into what the different shapes mean. So no, but the scallops on the side of your tongue, that fluting that you're
Yeah.
talking about, are
Uh-huh.
those are indications of a chi deficiency. So,
Okay.
and it depending on the location of them, like for the most part, it's sort of like all or nothing. But like if they're just there on the tip, then we would of course associate that with the heart or the lung organ chi deficiency. If it's just on the sides, we'd say liver, gallbladder. But if it's all the way around, that's a chi deficient picture. And really, what that comes from is that you'll see the tongue shape gets puffy as your yang weakens. Like it's the early stages, because once the tongue is actually really puffy and swollen, it's no longer scalloped because it's actually full. Like it's so full that it's not scalloped anymore. So it's just the beginning of that, which is why it's chi deficiency. And as it progresses and the tongue gets really puffy, then we start looking at things like yang deficiency. That kind of chi deficiency, like that can be a chronic thing, depending on how deep they are is another question that you have when you're looking at them. But
Hmm.
once you begin to sort of get the spleen back on track, where the spleen is actually making the chi more readily and more easily, you should see those scallops
Go
diminish on your
down a
tongue.
little bit.
So I do record them. And if you go to the blog, you'll see that I upload them to the website blog, and then I've uploaded all of them to a YouTube channel. So I actually have a YouTube channel where they're all going after I record them.